Hi, today I want to talk about something that is very common that I talk about a lot with doctors and hospital administrators, which is conversions. And we're not talking about anything religious here. We're just talking about the end result of a lot of work, which is confirming or booking that patient. And unfortunately, there is like certain confusion or misconceptions, and totally understandable because this is a field that is not within the medical realm. But it's important that they understand how it works, and hopefully, this video can help them to simplify things. Conversion is basically when the patient actually books a surgery or books a procedure or an appointment with you. This is the end result of a lot of work that in our case we have basically split it in two big areas, which is one, marketing. Marketing is going to be the tool or set of tools and strategies that will bring people to you. That doesn't mean that they're going to book to you, but they're going to get closer to you. You can do this through your social media campaigns, your SEM campaigns, through your websites, and all of these digital approaches, plus the offline activities such as trade shows and so forth. All of these will put your name out there and people will find about you and most likely will be interested in the services that you offer. However, you're not the only one offering this service. You have to realize that. And patients really like the second part of it, which is the sales aspect. If you don't have a trained team to actually respond to these requests of information, is basically the same as if you were just throwing all of the money and effort of your marketing down the drain. So definitely having somebody that is capable. It doesn't have to be the doctor. Actually, it shouldn't be the doctor because at the beginning, when a practice receives or a hospital receives a request, we don't even know if they are qualified for the procedure. And the doctors do intervene to make sure that the patient is qualified, but a lot of the communication does not have to come directly from the surgeon. They don't have the time and they shouldn't be doing this. They should be working on the surgeries. They should be working on how to become better doctors. And they need, however, the initial information is crucial to keep the patient interested and to follow the next steps. Usually this person is in charge of engaging with the patient, showing them a little bit of what you have to offer. But most importantly, we want to cut to the chase and offer the patient the solution that they need, we just need to find out if they're a good qualified patient to have the procedure that they're looking for. That's why doctors have to put their time to train these staff because they have a different set of skills. There's a specific profile that works very well with this type of positions. And this is something that might be a little bit controversial, but in my experience, the person that is on the phone on the doctor's side is crucial to make sure that that patient feels confident, that that patient feels heard and understood, and at the same time, they know that a doctor is not going to solve every single aspect of their medical journey, which may include transportation, hotels, and no patient wants a doctor taking care of that aspect. And even the doctors' teams, they're very much related to their activity, to their day-to-day activity. Very few doctors or specialists have made that effort of putting the actual training hours to their staff, but it's definitely the best advice I can give you. Make yourself time to train your people, make yourself time to prepare responses that make sense and that they go accordingly to the quality that you want to represent or that you're representing and that you want to make sure that people see in you. And it all starts with the first communication, and there's only one chance to create one first grade impression. So make sure your team is trained, and I hope this information and this feedback helps you. Bye bye until the next one. This is Andres Jurado from Cancun.